Welcome back to the Morning Blend. You know, 2 out of every 5 adults in the United States are caring for a family member who is sick or disabled. This month is about recognizing those individuals who devote themselves to others.
It's National Family Caregivers Month. Here with the details and tips on ways to care for our families, clinical educator Ellen Alberti of Healthcare Partners Nevada. Good morning to you. Welcome back.
Good morning. It's so lovely to be here. Thank you.
Well, can you give us the details about National Family Caregivers Month?
Absolutely. So this was started by the Obama administration, making November the National Family Caregiver Month to acknowledge all of those family members, friends, and relatives that provide countless hours to taking care of their loved ones. And at Healthcare Partners, not only do we want to acknowledge them, but also take this opportunity to remind them that caregivers need to take care of themselves as well.
No question. I mean, I've seen it firsthand. My mother-in-law is taking care of her 101-year-old mother.
Wow.
There's a lot of responsibility there. What are the important things that caregivers should keep in mind when balancing the care that they're giving and the care upon themselves?
That's a great question. So what happens with caregivers often is they feel the total accountability to take care of the loved one themselves and not reach out to other people, which can set them up for caregiver stress syndrome.
And tell us about that. What are the signs and symptoms of that syndrome?
Right. So caregiver stress syndrome, if you have it, you are finding yourself not interested in things that you used to enjoy. You're losing weight, and you're not taking care of your own health. And it can be very damaging to yourself in terms of your own physical and health well-being.
And inevitably, you're going to put yourself in the position where whoever your son or daughter is will probably have to take care of you.
Right. So some of the things that we need to acknowledge and tell our caregivers is accept help. Be prepared with a list of things that other people can do for you, even if it's running a couple errands, going to the grocery store, doing the dishes if you're in my house, and you know, just really spending time to take physical activity, well-balanced diet, and going to your own doctor's appointments.
A lot of people feel guilty about leaving the person that they are taking care of, but they need to get away just as much as anybody else does.
You're so right,
for their sanity.
They absolutely do need to get away, take time for themselves, keep their regular checkups, and stay healthy.
Now, Healthcare Partners offers a wide variety of services to the senior community, I know. Are there any special services that Healthcare Partners can give to caregivers in this situation?
Absolutely. Any patient with Healthcare Partners, we have the innovative total care model, which we provide a team of care people, physicians, care managers, social workers, you know, to identify all of the issues, whether they be a physical or mental well-being, and help them maintain the best quality care that they can.
And right now, this is also an important time for seniors because we are in the middle of Medicare open enrollment. Why is that so important?
Okay, so it's an app, thanks for the question. Medicare open enrollment started October 15th. It ends on December 7th. And this is the time where our Medicare patients can make decisions about what is going to be the best fit for them in terms of their care delivery. I don't want them to confuse it with the Affordable Care Act, because that's also open enrollment, but seniors with Medicare don't have to do anything different other than make some good decisions about who do you want to partner with in terms of your care.
And the Medicare plans change yearly. Even if you're on a plan that you knew what it was about last year, it might change next year.
Right. You're getting so great at understanding this whole insurance thing. I love it.
I'm gunning for a job.
Okay. Well, yeah, they do make changes. We've got to be aware of them. We've got a lot of events coming up to help educate our seniors, especially, about the changes in their health plan and how Healthcare Partners really is interested in partnering with them around their care.
If people want to learn more about the open enrollment events, we've got the information up on the screen there, and you guys are doing this till for the next couple of weeks?
Through December 7th.
Oh, wow.
Through December 7th.
Right.
So boots on the ground. This is a very important time.
And it's important because this locks people in for the next year.
That's correct, for the entire year, but hopefully our patients want to stay with us year after year after year.
Well, there's a lot of people aging into it as well that have to make these decisions.
Good point, that is.
Yeah.
And we've actually opened up 3 new clinics this year.
Yes.
So we're meeting the needs of the community and looking forward to having a great open enrollment.
I was going to mention the footprint of Healthcare Partners has grown. I'm at one of the newest locations, actually, on South Fort Apache. If people want to find the nearest location, how do they do so?
They can go on our website at www.hcpnv.com. They can follow us on Facebook and Twitter. So we are technologically savvy, looking to help grow our community.
Thank you, Ellen. It's always fun seeing you.
It's so great to see you both. Thank you so much.
Thank you.
If you're caring for a sick or disabled loved one, remember help is available. To find out more about that or the upcoming open houses, just go to the website on your screen. Healthcare Partners Nevada is also on Facebook and Twitter. Still to come on the morning.